sponsor is Alex Veloz from Cardinal Health. Alex has extensive background in health economics and outcomes research, has previously led Cardinal Health's economic and scientific communication functions, and is currently an independent advisor for health economics policy and reimbursement. Over the last 10 years, he's designed, developed, and led projects focusing on understanding the clinical impact and the economic value of medical devices to improve healthcare for patients, practitioners, and institutions. I'd like to welcome Alex to say a few words.
Apologies for the accent. I'm joining you from Chicago, but I'll do my best to make myself as clear as possible. So I'll bring on just a few slides here for you folks. Okay, thank you so much for the introduction. To tell you just very briefly a little bit about myself, I am a health economist by training. And I've had the opportunity to work with Cardinal Health for a number of years now, and most recently on a project involving the reprocessing of what is traditionally a disposable medical device so that it can be reused safely. And so we aimed to quantify the benefits of that, and so that's what I'll dive into here. A brief disclaimer before we jump in. The presentation here was developed for educational purposes only. I'm actually going to be presenting what is late-breaking research currently undergoing peer review. As an independent advisor, I'm required to tell you that I am compensating to present on behalf of Cardinal Health under all applicable compliance and regulatory requirements. With all of that said, let's dive into it. Who we partnered here with at Cardinal Health, you might know Cardinal Health is a large organization comprised of several different units. And one of those is the sustainable technologies business. They are really at the forefront here of collecting, again, devices that are meant to be disposable, and finding safe ways to reuse them and bring them back up to the original specs so that patients can continue to make use of them. So let's dive in. Hospital waste, I don't have to tell you folks, you're all here because you know this is a problem. Healthcare's mark on our environment is substantial, accounting for 105% of the global environmental footprint. And so as this awareness rises, countries and organizations are making strides towards sustainability, with purchasing policies reflecting this shift. So the background, a little bit more background on what we did. Single-use devices and supplies are paramount in infection control, ensuring patient safety by eliminating the risk of cross-contamination between procedures. However, these clinical and patient benefits come at a steep cost to the environment. Shockingly, disposables make between 59 to 71% of all of healthcare's carbon footprint. And so for a long time, we've been stuck between a rock and a hard place. Enter reprocessing, though, as an alternative. Reprocessing of medical devices is more resource efficient, produces less waste, and is expected to have a lesser environmental impact. So while that premise is sound, these claims have yet to be widely tested across the healthcare sector. And so that's our challenge, right? To validate these benefits. And so here I give further credit to Cardinal Health, who engaged myself along with a team of independent environmental engineers and other professionals to evaluate whether the environmental impact of their medical device reprocessing operations. So I'll be sharing with you the results of these analyses. In order to truly understand the ecological impact, we turned to a life cycle assessment, or LCA. It wouldn't surprise me if you folks have all come across these type of analyses in the past. LCAs allow us to determine the environmental footprint of a product throughout its entire life cycle. It considers the resources needed for manufacturing and assembly, as well as the environmental impact of reprocessing and the distribution of in this case, the devices, on the other hand, which can all be deciding factors in determining whether this is truly a more sustainable option or not. So the study subject that we chose for our analysis, we selected the intermittent pneumatic compression sleeves, or IPC sleeves, which are designed for post-surgery venous thromboembolism prevention. We have two main types. We have the single-use disposed of after one patient, and then we've got the reprocessed version, which is again reused by the patient as needed. So how do we go about comparing these two versions of the same device? Here is a very brief synopsis of a very technical and cumbersome process. In short, we performed a comparative life cycle analysis of the IPC sleeves that only differed in their use model. One is, again, a single-use device, brand new, and the other has been reprocessed. Therefore, we expect that the results would provide insight into the environmental and financial footprint of reprocessing compared to the single use of IPC sleeves. The questions we had at the outset were, do these reprocessed sleeves indeed offer an environmental advantage? And how does this influence our device selection in our collective push towards a greener healthcare system? Not to get too into the weeds, but I wanted to share one of the initial phases of this work is to prepare what we call an inventory, which is a detailed process model that includes individual steps for the single use and for the reprocessed product systems. So the flow chart shows a simplified model of the life cycle of IPC sleeves, both single use and reprocessed. The pre-components of the sleeves are produced in North America and then transported to the manufacturing facility in Costa Rica. The packaged IPC sleeves are then distributed via 35 replenishment or distribution centers to hospitals across the continental United States. And after the hospital treatment, after they're used, the IPC sleeves are either discarded by the hospital or they are collected for reprocessing. And we call that the use phase that you see up on the diagram. And so those collected devices are then transported to a reprocessing facility in Florida. And after successful reprocessing, they are packaged and distributed back to hospitals who opt in to the reprocessing, to using those reprocessed sleeves. So in terms of what we found in terms of results here, the comparison of the two systems is really meant to tell us what is ecologically advantageous by each impact category. And so that's what you have up on the screen. Climate change, reduction of emissions through reprocessing. And so we used standardized normalization factors set up by the European Joint Research Center. And you can see that there's outputs in several different categories, and all are comparable due to this normalization that takes place as part of the LCA. So without further ado, how did it turn out? The environmental footprint of the reprocessed sleeves was found to be reduced in every single one of the categories I showed you compared to the single-use devices, leading to a weight normalized reduction of 43% across all the categories. And so if I can focus your attention maybe on the bars that have the largest impact, you're going to see that ozone layer depletion leads to a 72.1% reduction, minerals and metals 61.1%, water scarcity over half of in terms of savings. So all of these impact categories show a reduction of more than 30%, except for freshwater ecotoxicity, one of the categories that's just under 30%, as well as land use. And those are the two categories where the benefits of reprocessed sleeves are the smallest, but they're still clearly benefits. So in order to better understand the contributions of these sleeves to climate change, the results breakdown with absolute numbers here illustrates the differences between the single use on the left-hand side and the reprocessed on the right, showing that for a simulated a treatment round of 5 patients that receive 5 brand new sleeves versus reprocessed sleeves, you see the difference here is a 40% carbon footprint reduction. And so if all IPC treatments in 2021 had used reprocessed rather than single-use products, we could reduce the carbon footprint by approximately 6,200 metric tons of CO2 equivalent. And this is just one type of product we're talking about, right? Just IPC sleeves. So the potential is huge. I'll leave you folks with this. You know, there are several benefits to the life cycle analysis method for the healthcare sector. Firstly, this life cycle assessment showed that even with rigorous standards around device cleaning and disinfection, there's still clear benefits to be gained from reprocessing and it yielding an environmental advantage. But that can't be said for all med devices, or other reprocessing solutions without evaluation. I hope this was helpful. Thank you all so much.